So how if I gave you a test drive of your smile before you even get one?
How is that possible?
That's what digital smile designing does. Dental health, oral health, is actually a gateway to your overall health because it's only the infections from the mouth that actually spread into our bodies through and make it into systemic complications. Like, you can get heart conditions, you can get lung infections, and you can get diabetes. All that is related to your dental health.
As human beings, the first thing we do is we communicate, and it happens through our smile, the way we talk, the way we laugh, and all of that. And it directly coincides with our teeth or how confident we are feeling from inside out, and it really affects the way we look at world or how we perceive ourselves confidently in front of others. I think a Picasso of dentistry.
Yeah, maybe better.
Welcome to this episode of Unfiltered Conversations. Today's guest is something which I am really excited about because this field has got so much of innovation, so much of development than the past 10 years, and I'm really excited to know because I'm really curious about this industry, and I also had 2-3 treatments done, so I'm very interested to know because I have somebody who is an expert, and I think one of the finest dentists we have in Pune today. And her journey is not just from Pune, but she started off back in Boston. From there, she was a managing director, and she had all the knowledge and expertise, but she didn't stop there. She wanted to come back to India and make an impact over here. And she started her beautiful venture, and we are going to delve into more details about it. So please welcome Dr. Tarvin Kaur with us.
Thank you so much. That was really a heartwarming welcome. Thank you.
Okay. So we would love to know about your journey and why did you choose this field of dentistry to pursue in your education when you had lots of other options, and especially when it comes to cosmetic, digital smile. There are so many new words which I'm learning today.
Yes.
What made you make that decision back then?
So you won't believe, actually, I'm from a business family. In my entire family, from both my mom and dad's side, there's nobody who's a dentist. I was in a boarding school in Missouri, and that's where my journey of dentistry started, because my forte was science, and dentistry was one of the things that I was interested in, and I took it up and I just decided, okay, let's just become a dentist. And believe me, from that day to today, I have never thought of being anything else in this life. Maybe I was meant to be a dentist. And after I finished that and I did my BDS, I actually did my BDS in Bharatiya Vidyapeeth in Pune. That's where my whole journey was done. I was just having a conversation with my dad, and he said, you're a dentist now, so now what? So I said, maybe I'll open a practice. He said, no. He said, if you want to be something, be the best at it. And that's when I thought of exploring further. I applied into US because it was all an American dream. We all lived that dream. And back then that American dream was really big. So I really worked hard for it, and I really wanted it. So if something I really want, I don't leave any stone unturned. So I gave a lot of applications, a lot of interviews. I followed it up. It took me a year to get admission in Boston. And BU was one of the most prestigious universities to go to, which I'm really lucky that I got that opportunity. Post that, I became the managing director, as you mentioned. And that's where I gained a lot of knowledge, a lot of experience working with the Americans or even from other nationalities, and being able to actually uplift that practice, because that particular practice was not doing well at that time. And it was like a challenge for me to bring the revenue up. I think that brought me going, that I know how to manage a practice now. I worked there for 5 years, and my heart was always India. Somehow I missed it. I think when I realized, when I was living the American dream, home is India. And I wanted to bring that standard of dentistry back in India. And that's when I came in 2008 and I started New Age Dental Care.
So tell me more about New Age Dental Care, because it's not just a center for beautification or medical practices in dentistry, but it is also an academy. You do a lot of stuff over there. So can you tell me more about it?
Yes. So, New Age Dental Care, I named it such because I wanted to keep reminding myself that I am going to keep up with the New Age dentistry, and I'm not going to be one of those, next door dentists, drill and fill. I mean, nothing against anybody. It's, I think, everyone's passion in life. So, since I want to be the best and I want to keep up and I want to give the best, I always made sure that New Age Dentistry is where I'm going to be taking my path to. So that name always reminded me every time I said that name that, come on, New Age, now what next? So I always went ahead and if I mastered a skill, I started practicing it to the point that it became comfortable, and then I was like, okay, now what next? So that what next kept me going.
Correct.
To the point till last year that I thought of bringing up the academy, because I felt, okay, I've established New Age Dental Care and I am going in that dental. But what about giving back to my dental field and to those dental students? Because I was a dental student once.
True.
And how I felt after graduating and not being able to get a job, not being, given that position that I wanted, and being very frustrated and lost. So I felt, why not help those little young graduates who come out of college, so I can help them and give them like a finishing school of dentistry. And I actually mentor them. It's not that I teach them in the academy and I say, okay, now find your path. I tell them I'm a mentor for life. So I have WhatsApp group where I have all my students and they bring up their questions or their queries and maybe the jobs, whatever it is to do with dental field or maybe even personal.
Absolutely.
I'm their mentor. So
there's one question which is coming to me. When you decided to start an academy, I think the underlining purpose behind this was because you've explored Boston, you've explored the Indian side of education also. So did you find any difference? That's why you felt like, no, it's my responsibility and duty to introduce certain practices that you saw are different and you found a gap in it?
Yes, I did actually. It's a very good point. So because I've had that opportunity to see the kind of dentistry there, we're very good with our theoretical aspect. When we do our dental education in India, we really stress on the theory part, which is important. But dentistry involves a lot of hand skill work. And that hand skill work has to be practiced. And they don't, the students over here don't get that opportunity in the college to practice that hand skill. And I think only after, and many of the times, even in college, they don't feel, they're not as serious until the time they graduate.
True.
So in Boston, when I was studying, we practiced a whole year in only hand scale, and theory was always a backstep because we were already done with our theory, and that is what stays with you. And that 1 year of skill practice is what I realized, that's what makes you a good dentist, because eventually it's your handwork.
Absolutely.
So that's what I am doing with this course that I give of 5 days. It is only clinical skill work. I don't sit and lecture them. I don't give them any theory. I don't even give them a paper. It's only by practice and skill work that I'm working with.
That's amazing. And this one thought was just coming in my mind that dentists are like a Picasso of dentistry. Because every customer, every client is you have to use your art to create that custom beautiful smile for them. There is this interesting thing which I have read in your bio, which is digital smile designing. So can you tell me about that?
Digital smile designing, basically what we do is we use the technology and we capture a lot of your pictures, extraoral, even the inside mouth, and without even doing any physical work on you, we program that into our software and we design it digitally first. So the entire smile is digitally designed by our knowledge of how the teeth aesthetics should be, matching to your face, to your eyes. So exact matching is done on that software. And then we duplicate that into your mouth without doing any physical work. So what I do in my practice, I think that's one of the things, because my whole mission is to remove the dental fear. I challenge them, I tell them, when I'm done with you, you will love dentists, and that's my challenge. So if I can remove that dental fear and I can fix their knowledge about dental care, I think, they will not face so many dental issues in future. So it's only the ignorance and not keeping up with regular checkups and not believing that they need that. That is a dental issue itself. They need to understand that dental health is very important. So dental health, oral health, is actually a gateway to your overall health. Because It's only the infections from the mouth that actually spread into our bodies through and make it into systemic complications. Like, you can get heart conditions, you can get lung infections, and you can get diabetes. All that is related to your dental health. And people don't realize that there is a huge link, because your bloodstream is connected from your gums all the way to your heart directly. And that's how, you see a lot of increased issues of heart, even diabetes, sugar control. And these people don't even know that dental health might be the cause. So they're not actually treating the cause, they're treating their diseases. And regular dental health checkups is a must. So even if you can't do it every 6 months is what is mandatory, I would say at least do it once a year. Brushing twice a day, we have always said it over and over again. But people don't realize that if you sleep with a clean mouth, we sleep for 6 hours, 7 hours, typically our mouth is dry, and that's the time the bacteria is harboring in your mouth. So in the night, brushing is even more important. So you are basically brushing in the morning for bad breath, but you're brushing in the night to clean your teeth. If you can clean and maintain your teeth, and maybe use a water flosser after breakfast before you head out for the day, because we all brush, we all eat our breakfast and just say, okay, we're done, we'll head out. But you don't realize the food particles that are left stuck in your mouth. Do a water flosser, or even least rinse your mouth out. And diet plays a big role.
True.
So diet, like, avoid sugary substances. I mean, avoid now number of sugar intakes in your day. You may like to see, I like to eat sweets. I would probably eat it every day. But I'm not going to eat it 5 times a day. I may choose, okay, let's say once a day. That sugar craving that I am going to have it. But typically if you have it after a meal, that's when your saliva flow is quite plenty. And once you have the sweet, it tends to wash out the sweet from your mouth much faster. So that's a good tip to know, that have a sweet after a meal if you really want to. But don't keep snacking, and especially in between. So
the binge eating.
Yes.
The binge eating for us. What role does, veneers play? Like, I had this question in mind, because usually, like, I did my aligners with Invisalign a few years ago, and that time I was in a dilemma. So should I go with veneers, or should I go with Invisalign, or what do I do? And there is this theory around veneers, and a lot of celebrities do it right now, and it's a trend. Like, a lot of Gen Zs also opt for it and everything, but you have to lose your permanent teeth for doing the veneers. That's what I heard. And there are good options like aligners also, which we were discussing. So can you tell me about the difference between veneers and aligners, and who should opt for veneers and who should opt for aligners?
That's actually a very good question, because aesthetics is a big thing, even compared to your smile makeovers or even Botox on fillers. Everybody wants to look their best. And why not? When we have the treatment options available. So let's take about veneers first. Veneers is when we are doing a smile makeover on a patient who doesn't want to do. Typically, somebody who comes to me for smile makeovers, I will always give them the most conservative way to do it first. So most conservative way would be aligners or the traditional braces. There are different indications for both. I will not say, even though aligners are very popular these days, I'm not going to say that aligners fix all the problems. Yet the traditional braces are definitely the best choice of treatment to align your teeth and to have that smile makeover. But with being adults and our constraints, we don't want to go for brackets and wires, and so we are opting for aligners. Aligners, when you opt for them, must be done with a dental professional. I would not trust a company who is giving you hopes that they will correct your teeth by coming home and doing it for you, with the scanners coming home. But you need a dental professional, because if alignment is not done right, people don't understand that teeth and the muscles are connected to your entire head and neck region, and things like headaches, neck pain, shoulder pain, all this can be triggered by a wrong bite. So you won't believe, even things like migraines, it can be triggered by a bite, a wrong bite. And people keep thinking, why am I having these migraines? But they don't realize it's the bite which has been moved or not correct. And by just correcting that bite, they will be able to solve that problem. Instead of popping medicines and doing Botox injections and going to doctors completely. So imagine the teeth play such a big role.
Important role,
Now, if in case they don't want to go for any of these treatments and they opt for veneers, veneers are not always that we need to remove tooth structure and put veneers. Nowadays, we make veneers which are as thin as 0.25 to 0.5 thickness, which is really thin. So especially for older individuals who have worn down teeth, we don't even reduce their teeth anymore because they need that bulk coming in, right? So we make these veneers. Veneers are, you know what? They're just like these thin, you know how you get those nail arts done? Have you seen those acrylic nails?
Like ceramic sort of.
So these are ceramic shells. How you have acrylic shells for your teeth, these are ceramic shells for your teeth. Sorry, acrylic for the nails. Once we cement them and once we put them up on the teeth and they're bonded, you can practically have everything because dental, as I said, technology has improved so much. Our materials, our bonding systems, it's no more that we do veneers and we say, oh, you can't bite this and you can't eat that. There are no restrictions on food.
And what about the myths also? You can't have a bread or you can't just bite on a pizza.
But I think nowadays the dentistry is that if you've done a certain treatment, there is no restrictions after that.
Oh, that's amazing.
So that's where dentistry has advanced. So veneers are also conservative, but if your teeth alignment is to the point that would require a lot of preparation or reduction, which will compromise their strength, I would not go for that. And that only a good professional dentist would be able to advise you.
No, I think this is a very important point what she said, because usually I've seen cases where you just go and you just drill your teeth out and there's no going back to your original teeth. And she exactly bust the myth about this, because I had in mind that you have to completely drill your teeth and then place the veneers, sorry. But this is a good revelation for me. And how about aligners? Like there are also, I had options of, the way you said that quick aligners, and there is an option where you rightly said that there is a whole process, that there are continuous checkups with the dentist. They are going to check how your jaw structure is has it opened up, are the gaps filling in well? If they think that they are not filling in well, they are going to change your setting a little and they are going to be doing it like an art. So can you talk about that a little?
So there are many aligner companies now. Actually, it's also unfortunately become very commercial. And I would suggest, like, if you're going to a dental professional you trust, then they would be the best people to tell you which aligners to go for. We have Indian aligners and we have Invisalign. Now, Invisalign, like you suggested you did, are the pioneers of aligners. And by far, they are the best. The kind of technology they have, the kind of aligner material that they use, and the kind of digital technology they have, I haven't seen anybody surpass that. But it comes with a cost. So it's like you always get what you pay for, right? So it's like if I go to buy clothes, if I'm going to buy from a fashion street as compared to going to Zara or Mango, there is going to be a difference of quality.
Absolutely.
So you as an individual decide how valuable is your health. And that's when you make your decision as to which aligner to go for, because I don't think it should be the price that should be the deciding factor. It should be what actually is working for you, because once you do the aligners, would you do them again? No. It's a once in a lifetime thing which is going to last with you for the rest of your life, because now the dentistry is that everybody dies with their teeth in their mouth. You know that. It's no more those dentures that come out and the person is not there. So everybody has their teeth till their last day. That's what dentistry has become.
Well, that's amazing, because I'm really liking this episode, because I'm getting to know a lot of things which I had personally doubt on, and I get this chance to sit with you, one of the best in Pune, to do that. Your specialization is also in the dental implants.
Yes.
So can you tell about what are the significant developments and what are the improved outcomes from your end which you have introduced at New Age?
Okay. So dental implants, imagine dental implants have been done, must be over 30-35 years or more. I've been doing them in the last 12 years and different implant companies and a lot of things have improved over that. So initially we could not do implants for patients who didn't have enough bone, because we need bone to do implants. But do you know that dentistry has improved so much that there is no single contraindication for an implant. If the person even doesn't have bone, we have found all ways to create that bone for them to be able to place the implant. So if a person has missing tooth or missing teeth, if you're going to compromise their adjacent teeth to be able to replace those missing teeth, it's considered a dental sin. I mean, that's something that I would say you can't do as a dentist. Even if, even the finances, if you feel a bridge or something that is going to cost you lesser than an implant, it's no more like that, because implant companies, there are so many different varieties and companies, and they are of all prices. So you can decide your economics and decide, okay, this is something I can afford. You can yet go and do an implant as less as even for 10,000 rupees.
Amazing.
So if you can get a replacement of a tooth, which is as close as you can get to a natural tooth without damaging anything else that you have in mouth, so why not go for that? And now the recent advancement that you're talking about, we're doing guided implants. So digital technology has come into implants line, and we actually create these surgical guides which are digitally planned, like how we do a smile makeover test,
absolutely.
right? You make that guide on the day of the implant placement. Once you place the guide in the mouth, there is an entire area which is given for the implant placement. So it's no more by clinician's judgment. It is digitally planned, the guide is placed, and the implant is placed exactly, precisely at the location, which is measured by your x-rays, by your pictures, by all the data that we've collected, and artificial intelligence.
But that saves so much of time, and it's
precision,
precision, like
predictable outcomes, and there is no I can't say that implants are 90% successful. They are 100% successful. I think unless somebody has a systemic condition, that's the only issue. But if it's done with the protocol, there is no failure.
In fact, the recovery also might be so fast because of the precision which
is painless. So that's one of the, I think, fear of patients. They said doing an implant surgery, first question they ask is, how painful is that? I said, there is no pain in the procedure and there's no pain later. You can actually go back to your work after I'm done with your procedure. It's as simple as that.
That's amazing. There is this laser dentistry that has also changed the landscape of the whole space right now. So can you talk about that? And I think I'll also ask you a question about the gums after this.
Sure.
Yes.
So lasers have come big in every field. I think even skin is doing wonders with laser. I mean, people who couldn't get rid of their pigmentations and marks, they are looking flawless.
Yes.
So lasers in dental field is doing extremely well. I mean, we have hard tissue lasers and we have the soft tissue lasers. So there are lasers which are meant only for the gums and your soft tissues. And there are lasers which are made only for your teeth, because teeth are hard. You can't use the same lasers for different. So, when we used to do gum surgeries before, we used to use a blade and a handle. Now, can you imagine the kind of bleeding and the trauma that we must be causing to the soft tissues? Lasers are basically a concentrated beam of light, which is used precisely at the area we're working on, and we are able to shape and change the tissue without affecting anything around the surrounding tissue. There is no blood. There's no anesthesia. Most of the times when I'm using my laser, I don't even numb the patient up. I may apply a little gel. So even that comfortable a laser is, that they're not even feeling the pain. And the healing after that, if there is no bleeding, the healing is perfect. Initially we used to give stitches and we used to put a pack. All that thing is a pass. So now in dental clinics, you can work without hard tissue laser. It's not necessary that all the dental clinics need to invest in that. It's a huge investment, but it's a very different, so if people have the passion for that, they do go. But soft tissue laser, like how we can't work without a handpiece, you can't work in a clinic without a hard tissue, without a soft tissue laser.
That's amazing. And I think what you said about the recovery, they just give a vitamin E capsule and you just have to put it, and then you're just...
Yes.
Yeah, because I did that. I think it was the same soft tissue laser which they did for my gums. And it was literally, I could see the tube like of...
You've been a dentist delight, I think.
I love researching about things. So
lovely.
So I did one of my gums was a little low and it wasn't looking good in the profile. So my doctor who was doing Invisalign, he suggested that just go for the gum surgery with laser.
Yes.
Soft tissue laser, and it's not going to hurt you.
So you've had that experience yourself?
I had that experience. I was imagining and visualizing the same thing which you're saying, and they just gave me a vitamin E pill.
Absolutely.
And then I was just
no antibiotics, no painkillers, nothing.
I just could see that was a little traumatic for me to see from that pipe of things going out.
Yeah.
But apart from that, it was a painless
Yes.
procedure for me.
Yes.
But yeah, like that was amazing, and I think you don't have to fear a dentist anymore because there are so many technologies, and trust me, I've been there, done that, so I know that it is painless. My next question, or rather something which I have personally dealt with when it comes to confidence, and we as human beings, the first thing we do is we communicate, and it happens through our smile, the way we talk, the way we laugh, and all of that, and it directly coincides with our teeth, or how confident we are feeling from inside out, and it really affects the way we look at world, or how we perceive ourselves confidently in front of others. So do you have any experiences or incidences where you've had patients gain back their confidence, or anything which has changed their lives for good?
Yeah, in fact, I think my journey with digital smile designing started that way. I won't name the person, but a very close friend of mine used to tell me, I really want to do something about my smile. I don't want to take pictures. And she used to not dress up, and she wanted to be social, but I think that just her smile kept her back. And the fear of her not looking good if I worked on her, she wasn't sure. So when I did my digital smile designing, I offered it first to her because she was one of my very close friends. And I told her, come, I have, got a new skill. Let's see how that goes. And like I said, we did the test drive, we did everything, and it went. And that was my first successful case. That was about 8 years ago. And till date, she sends me pictures, and her dressing sense, she's joined a lot more social groups. She's become very confident, and she yet, sometimes will send me a picture and say, all thanks to you. And that's my feeling, and that's my passion for keeping it in dentistry, is that I could make that difference in her life. And she yet is so thankful for it. I mean, what else do you want in life? It's not always the money. It's a lot of satisfaction from what you do and how you can change somebody's life. I think that's the art that I love in dentistry. Even for people who come with severe pain, I can't tell you sometimes, the pain is so, if you have a dental pain, you're not able to even, focus. You won't be able to work. You won't be able to do anything. You won't be able to sleep. So I can actually relieve their pain in just maybe 15 minutes in my clinic. Imagine the satisfaction that you get as a doctor, that I was able to relieve that pain for a patient. I mean, what more better than that? I think it's such a wonderful profession to be able to make such a difference in someone's life.
Absolutely. And it is like very important role which dentists play in anybody's life. Like, people don't realize that, but they are the backbone.
Yet we want to ignore them.
So is there any untold realities or truth you have to go in your daily life, and you would like to break them today? Because I know for a fact that there are so many things which people just they have misconceptions about. So would you like to say something about that?
So I would say, first thing with dentistry, people don't realize. Let me tell you an example. Like, many times, I socialize a lot. I do network. I love networking with people. I like to go out. How much ever I love my profession, I also love my social life. And when I go out, anybody new I meet, they'll always say, oh, what's your name? And I'll be like, Dr. Tarvin Kaur. And they're like, oh, you're a doc. And then I said, yeah, I'm a dentist. Ah, you're a dentist. And I'm like, really?
Yeah.
I mean, I'm not going to stand there and explain to you how important dentists are. And if you're going to start proving me that dentists are not doctors, I think that misconception in people's head needs to change, because we are actually the first line of treatment in a human body, because the oral health, like I said, is your gateway to overall health. So if your dental health is not taken care of, you pick up a lot more systemic conditions because of that. So you need the dentist first, and then you will be needing, obviously all the doctors are important, but don't tell me that dentists are not doctors, because your teeth and your gums and everything is connected intricately, completely to your head and neck and your body. It's not a separate part. It is part of your human body. So the importance of dentists, I think people need to understand, and how stressful our profession can be. To be able to do the best every day, it is a lot of stress, because we have to deal with patients' anxieties, their expectations, and we have to be so precise with our work.
Yeah.
So do you know we work with magnification loops now and microscopes because the kind of precision we can get with that, we can't see it with naked eye.
True.
So even now, like dentistry, if you're not practicing with magnification, then you're not doing dentistry. So it's come to that point. So imagine the precision that we have to do, the kind of skill that we need to have, and only if you love it and you are passionate about it, then you'll be able to give in so much. So I would say, tell to all the dentists, in fact, don't reach to a point that you'll have a burnout, because it is a tough field.
True.
Do how much ever you can to the best you can, and understand how much are you able to do in a day. Don't overstretch yourself because you want to see X number of patients a day. See lesser, but do your best. So I would say avoid that burnout, because a lot of dentists, I think, over the years really feel that burnout and they get stressed and they don't enjoy it anymore. There's so much to do in dentistry. I feel with evolving dentistry, there's so much change happening. If you keep adapting yourself and keep it, it's not boring. It's very interesting.
True.
So it's just that, you know, you need to be understanding that.
Yeah, and more like adaptive, like you said. And it's also expensive, right? Like it's very expensive to have constant technologies and being at the forefront of making sure that you're getting all the latest things in place for you. So you also cracked a joke behind the scenes where you said that it's the precautions which you don't take are expensive.
So it's not, dentists are not expensive, it's the negligence that is expensive. So people who are neglecting their issues or making it just, they just make it bigger. And then they come and say, oh, the treatment is so expensive. And I'm like, okay, you could have minused of the last 1-2 years that you were sitting on it and paid 1/3 the price.
Correct.
So again, like I said, health should be your priority. I think the most precious thing is health.
True.
So don't compromise on that, and please don't let price be the dictator of your treatments. So I would say at least people should get that in mind, and little small things. It's very easy to just go and get it checked and get it done, rather than doing home remedies and putting all sorts of things.
Don't opt for Dr. Google.
Please do not. Please do not listen to Dr. Google. So don't make it big by just doing home remedies and saying it will go. It does. It never goes.
It never goes. It just builds upon that. My last question before I start a rapid fire, which is not there.
Oh, really? Okay.
Is what is your and New Age's vision in the next 5 years to kind of change the dynamics of dentistry?
So at my practice, I am very particular about time management, about the ethics, and I really value the trust the patients have in me. Maintaining that trust is where I'm going to take New Age Dental Care. It's if you see my Google reviews or you see the feedbacks that I get from my patients, I mean, that's what keeps me going, and I feel that personal touch that I have in my patients, I'm never going to lose that. New Age Dentistry will always be my forte in my practice, and doing the best for the patient will always be what I want to do. Kaur's Academy is going to keep mentoring the young dental graduates, and I also want to bring international dentists to Pune. That's how I do workshops, because I want to bring upskilled dental professionals here, so that Pune dentists can get to train at an affordable price, because it becomes cheaper for them once it's in town. And so let's see how it takes me from there.
That's like a bird's eye vision for not just you, but to kind of improve the quality of dentistry in Pune and beyond. I think I'm sure you're going to start a lot of centers across Pune. I think I'm having a gut feeling for that. You're definitely going to do that.
Thank you so much.
Now let's start with the interesting surprise, which is the rapid fire for you.
Do I get a hamper also once I'm done, or there's nothing?
We'll send one hamper to you.
Super.
Okay. So the first question from my end is, name 3 bad food items for your teeth.
Okay, so Coke and candies and starchy food, the chips and the French fries, anything that sticks to your teeth.
The good ones.
Fruits, vegetables, anything crunchy, hard, water, water.
You're wearing veneers?
Yes.
But they're looking amazing. I was trying to see whether they are so real. I mean, like it looks amazing.
Thank you.
Who's the good cop, like the aligners or the veneers?
The aligners.
Amazing. One title for yourself as a doc.
As in, what do I think? Okay.
What do you think about yourself? Like a superpower, whatever. Like one title for yourself.
I would just call myself a humble dentist.
I think a Picasso of dentistry.
Yeah, maybe better.
Picasso of dentistry. Okay. One funny incident while treating somebody. Like one funny moment. Okay, answer in yes or no. Have you ever puked looking at somebody's mouth when you're doing it? So I know that.
I haven't puked, but sometimes you get these patients who have a tremendous amount of build-ups, and they'll come just before lunch for their cleaning, and then they will insist, no, Dr. Kaur, you have to do it, and that's one of the times that I feel like, am I really in the right profession? Okay. That's a challenge.
That's why, like, I was just imagining.
Yeah.
Has there been any incident?
Yeah. How much ever I don't think about, because I'm a doctor, it's like nothing grosses me out.
Yeah.
But that one.
I
think my pet peeve for this, if there's food collected in the teeth. People come with coriander or little green leaves somewhere, sorry to say, but that can really put me off.
The worst is onion.
So I always, at least I think for viewers watching, please just brush your teeth before you go to a dentist.
Yeah.
That's it.
But that was a fun rapid fire and you've answered brilliantly.
Thank you so much for having me.
Thank you, Tarvin ji, for being such in sport and revealing a lot of things about dentistry which we usually don't get to see apart from just going to Dr. Google. But she's the one you need to opt for in Pune, and definitely we're going to share all the details about her, and it was an honor, absolute honor to have you. Do watch this episode on Unfiltered Conversations YouTube channel and Instagram to know more about our fun moments and a lot of secret revelations about dentistry that happen. So thank you for tuning in.
Thank you so much. Thank you so much. It was lovely.
Thank you.